Hi, everybody. My article was entitled Shoe Cushioning, Body Mass, and Running Biomechanics as Risk Factors for Running Injury, a Study Protocol for a Randomized Controlled Trial. So this was in the British Journal of Medicine. It was July 2017. So I thought the title was really interesting and it kind of includes all of what we talk about with our patients daily. The main aim of the study was to investigate the influence of shoe cushioning and body mass on running-related injury, RRI risk, while exploring the association between running technique and this risk of injury. It was a double-blinded, randomized control trial, the first of its kind, to look at this type of information. It involved about 800 healthy leisure time runners. They randomly received one of two running shoe models that differed in their cushioning properties by about 35%. So it was a decrease in stiffness from one to the other. So the hypotheses they tested were pretty expansive. The first one was running shoes with greater stiffness are linked with a higher risk of injury. Second, high body mass is associated with a higher risk of injury. Runners with the high body mass experience a lower injury risk in shoes with greater stiffness. Fourth, a higher step length, a lower step frequency, and higher vertical loading are associated with higher risk injury. Running shoes with greater stiffness will be associated with higher vertical loading rate and shorter contact time. They're kind of like repetitive, obviously. The sixth is high body mass will be associated with higher vertical loading, increased contact time, increased duty factor, and decreased step frequency. So I was kind of disappointed because the conclusion showed nothing. There's no studies that have investigated the impact of shoe cushioning on injury risk, which I thought was really surprising. The studies do not provide any evidence on the beneficial effect of increased shock absorption properties, so it was inconclusive. Basically, they said there weren't enough participants, so each study had like 250 people. So I guess the total amount, 800, wasn't enough to really conclude that the higher cushioned was more effective in reducing the risk of injury. They said more controlled studies need to be performed. It was a very big undertaking trying to compile the data on both the running technique and the running injury risk at the same time. So, AKA, more studies need to be done. They did say that, like anecdotally, a lot of physicians, they didn't mention PTs, but a lot of physicians educate their patients on these things, but they wanted to look at the data to see what the data showed, and it was inconclusive. So looking forward to discussing it together. Thanks. Bye.